child is not breathing, only rescue breathing is necessary. Give one rescue breath every 3 seconds or 20 times a minute. When a child is not breathing, and you also determine there is no pulse, you must combine rescue breathing with chest compressions while maintaining the head tilt. To find the right place to do chest compressions, begin by kneeling close to the side of the child's shoulders. Use the middle and index fingers of your hand nearest the child's legs to locate the lower edge of the child's rib cage on the side nearest to you. Then, run your fingers up along the rib cage to the notch where the ribs meet the breastbone on the midline of the body. Next, place your middle finger on the notch and lay your index finger alongside the middle finger. This will ensure that you are above the tip of the child's breastbone. Then, place the heel of your hand just above the index finger. This is where you do chest compressions. Position your shoulders directly over your hand and lean forward so that the main force of the chest compressions is straight down. Keep your elbows straight and locked. Compress the chest downward 1 to 1.5 inches. The CPR pattern for a child is 5 chest compressions to 1 rescue breath. Count out loud while doing the chest compressions. 1 and 2 and 3 and 4 and 5. Then give a rescue breath. The chest compressions are at a rate of 100 times a minute. Keep the compressions regular and smooth. Avoid rocking or jerking movements. Allow the chest to return to its normal resting position after each compression. While performing chest compressions, continue to visually check your hand placement.
1 and 2 and 3 and 4 and 5. One and 2 and 3 and 4 and 5.
If at any time during CPR the child vomits, turn the child onto his or her side, support the neck, and clean out the mouth. Restart CPR with a rescue breath.
One and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5.
When you are alone with a child victim, perform CPR for about 1 minute. Then, if a telephone is easily available, quickly phone for emergency medical help and immediately resume CPR. Restart CPR with a rescue breath.
1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5.
Continue CPR until the child has a pulse and is breathing.
1 and 2 and 3 and 4 and 5.
Once there is a pulse and breathing, continue to keep the airway open and watch closely, making sure the pulse and breathing don't stop again. Continue rescue procedures until help arrives. We will now review the CPR steps for children.
Are you okay? Are you okay? Help! Help! Somebody help!
Position the child onto the back. Open the child's airway. Look, listen, and feel for breathing for 3 to 5 seconds. Give the 2 initial rescue breaths. Check for a pulse. If there is no pulse, begin chest compressions.
1 and 2 and 3 and 4.
Give
and
5 chest compressions to 1 rescue breath.
1 and 2 and 3 and 4 and 5.
In addition to knowing how to do CPR, it is also important to know how to care for a choking child and how to remove a foreign object airway obstruction. However, you should not confuse a foreign object airway obstruction with airway swelling resulting from an infection such as a cold or bronchitis. In this case,